Good morning. I'm Alan Thompson. I'm the mayor of the town of Riverdale Park, but I'm also a professional scientist. Every month at town council meetings, I discuss the current situation with the COVID-19 pandemic as part of my mayor's report. This week, because of the intense wave of COVID-19 infections sweeping through our community, I took a recommendation from Ward 2 Councilmember Aaron Foe to record a special video and speak to the community directly. The wave of COVID-19 infections is driven by a new version, a new variant of the virus that causes COVID-19. That variant is called Omicron. There's a lot of bad news about Omicron. First of all, that there's a new variant of the virus at all. The second is that it is highly infectious. We have a huge number of cases in the county right now, around 250 cases for every 100,000 residents per day. That's almost 25 times what it was a month ago. The positivity rate, the fraction of tests that come back positive, is above 35%, more than twice what it was in December, and 3.5 times the level it is when people begin to get concerned. We have the highest levels of infection yet seen in the entire pandemic, 5 times the next highest peak rate, which happened last January. Yesterday, news came out that in Montgomery County, more than 10,000 students and staff in the public school system tested positive for COVID, and 126 schools in that system had more than 5% of the students test positive. Almost every full classroom in those schools would have had a positive student in it if they were full. All of these numbers are with an overwhelmed testing system. It's really hard to get tests to find tests, and no counts from coming in from at-home tests. The bad news goes on that most hospitals in the state are full. Some of them have been full for weeks at this point. There does seem to be one piece of good news, and that is that the Omicron variant is milder, 3 to 4 times milder than previous variants, maybe as much as 5 times. But even with that, daily deaths from the virus in Prince George's County are higher than any time since last February. Remember that 5 times milder with 25 times the number of cases still gives you a huge number of very sick people. So what can you do in response to this news, to this new variant? First of all, I want to make it clear that this is not medical advice. I am not a medical doctor. This is my personal consensus of scientific opinion as it is evolving at this time. So the first thing to do is vaccination. It's probably too late for the current Omicron wave, but it's likely that there will be more variants in the future. Recent news coming out of New York City, which is maybe a week ahead of us in this wave of the virus, 90% of those in the hospital are unvaccinated. The vaccine is very protective, and you should get it as soon as you can. Both the initial dose, a second dose, and a booster, all three are needed to combat this virus. Second piece of advice, stay home as much as you can. This virus is passed by contact between people. If you are home and you are away from other people, you will not transmit or receive the virus. I understand that many people cannot stay home. The school system may require students to go to class. Your work may require you to come in, but as much as you can, try to limit contact with other people outside of your home. Next piece of advice is to wear the best mask that you can get. This is based on a somewhat controversial scientific opinion that COVID-19 and many other respiratory viruses are now thought to be airborne, that they are transmitted by small droplets of liquid that contain the virus, and that these small droplets can remain in the air for up to several hours after they are exhaled from an infected person. So the best advice is to keep those from getting into you, and masks will do that. So what are the best masks to get? The best mask is an N95. The next is what I'm calling a trusted KN95, because sometimes KN95s, which are the Chinese equivalent of N95s, are counterfeit and are not actually working. The third is a KF94, a Korean high quality mask. These are not quite as good as the N95 class masks because they don't fit as well onto your face, as tightly onto your face. Next, beyond that, are surgical masks, and at the very bottom of the list, the cloth washable masks that many of us have been using during most of this pandemic. To help you find the best mask that you possibly can get, the town acquired more than 30,000 masks to distribute to residents, and we expect another 30,000 to arrive today, this Friday, as I record this message. We've been focusing on delivering these masks to as many high-risk residents as possible, and will continue to do so. We know that we are missing some people who cannot get a high-quality mask on their own, and are hoping to set up a place where town residents can pick up masks if they need them. We are also hoping to distribute masks to workers at town businesses who are at high risk. We are distributing guidance with these masks on how to use them to allow you to be as safe as possible. Please stay tuned as we develop these programs, and let me know if you have ideas on how to improve them. Next piece of advice: if you test positive, isolate from others. If you test positive on any test, whether it's an at-home test, a rapid test at a clinic, a PCR test, or you have symptoms, chances right now are that you are positive. You should act like it and isolate from others. As I said earlier, consensus is that the virus is mostly transmitted via airborne droplets, and that means that ventilation is key. Make sure that those in your household who are not yet diagnosed with COVID have lots of fresh outside air. Cross ventilation, if you can set it up, is key. Second, everyone in your household who is more than 2 years old should wear masks at all times possible. This is if you have an infection in your household. This is an imperfect analogy, but if you imagine that the person who tested positive is chain smoking cigarettes and you don't want to smell it and you need to do what you have to do to keep the smoke from moving, to keep that odor from moving from room to room, that would protect you. Again, it's an imperfect because the masks will not screen out cigarette smoke, but they do screen out the virus very effectively. Next big piece of advice: assume when you are out of your household that you are positive and also that everyone you see is positive. We have a statistic from the City of London where a few weeks ago, 10 to 20% of all Londoners are positive. That's an incredibly high number, and it's supported by the numbers we're seeing in the Montgomery County school system, that we may be there now or we're going to be there soon. So make that assumption and avoid situations where you might transmit or pick up the virus. There's been a lot of discussion recently about how Omicron is so infectious that we are all just destined to be infected. I don't think that's true. I think that by using these techniques, we can avoid it, but there are good reasons to try to avoid that infection. First is to protect others in our community, particularly young children and the immunocompromised, including the elderly. And the second is to protect yourself. It's not been discussed very much, but a big problem with the virus right now is long COVID. This is where symptoms of COVID or damage to your body from COVID can persist for months or years, perhaps permanently, after the virus. And even mild cases are now indicating that 10 to 20% of mild cases have long COVID symptoms. And the more serious cases, if you are hospitalized or put on a ventilator, are even worse. Thank you very much for paying attention to the video and being with me today. I hope to have other videos in the future, and I look forward to discussing these items with you in the future. Thank you very much.